Well, thanks so much for joining. Speaking of making healthcare work for you, different perspectives and empowering solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta, and today we welcome Leon Evans, who is the former president of the Center for Healthcare Services. He received the American Psychiatric Association Gold Award. He's a past CNN mental health warrior, and he has testified before Congress, among many other things. He's incredibly accomplished, and this conversation is going to be really amazing because Leon has done so many great things around mental health, from working with the homeless to working with the incarcerated and trying to keep people from becoming incarcerated, working with mothers who have been addicted to drugs and helping them keep their babies. He's really just incredibly mission-driven and focused on helping people, starting with hope, dignity, and respect. So with that, Leon, why don't you tell us, why is this so important to you? How did you get involved with this?
I've had a great life and great opportunities. So I was just a poor kid from Oklahoma that was able to go to college on a athletic wrestling scholarship. And I was a business and finance major, and there's a state hospital in Norman, and they opened up an adolescent unit, and they came to Young Christian Athletes Association and asked for volunteers, and I was one of the 2 volunteers, and fell in love with that work and those children, and changed my major the next semester. So that was 1966. So I've been doing this a long time. And just like everybody in our field, I started off, on the lowest rungs, doing the direct service with people, and kept having these opportunities to grow and learn. So my education has really been from the ground up and not the top down, and that's, I think, what's helped shape my philosophy about treatment and how treatment is designed to really work.
Can you tell us about that, Leon? It sounds like such an amazing journey over spanning more than 5 decades. What does it mean to be focused on the treatment from the ground up? Why is that different, and why is it so powerful in your eyes?
Well, because it's so patient focused, and your audience probably knows this. They're really not as interested in the research in treatment and how they're treated. They're more interested in getting well and having their treatment providers understand them, and help them get to a place where they can have a meaningful life. And so many times in my field, which is the public field, is underfunded. We're overworked. We get lots of regulations put on us that really aren't helpful and don't work. And it's not from the patient's viewpoint as much as it is from academic research. And I found that academic research many times is beneficial in best practices and help shaping what you do on the ground, but not necessarily workable, because usually the research that's done at the federal level, you have small patient groups, you have the right funding, you have the right support system, and if you just say, "Hey, that works," and you try to push it down without the additional funding and the additional resources, it's a dismal failure. And so it just dawned on me, kind of mid-career, that I really need to talk to the people that we serve. And what I found out, and especially from one person back then, a lady named Janet came to my office, and she said, "Leon, you give me everything except what I need." And I said, "What's that, Janet?" And she said, "Hope." And it just struck me what she actually elaborated on that. And I said, "Hope." And she said, "Yeah, you have great doctors. I have great medicine, but I don't have a life." And I was telling Stephanie earlier about this program. I started the mental health center north of Houston, Montgomery, Liberty, and Walker County, called Tri-County, and we started an affirmative business, a business where we could hire people who were mentally ill and addicted, who were in recovery. And so one of the contracts we had was with the Texas Department of Highways. We bid on it, and we got it, and we saved the state a lot of money. And the money that we earned was significant to the point where I could pay more than minimum wage and give some benefits to these people in recovery. And in Texas at the time, we relied pretty heavily on oil for revenue for the state, and we had a downturn in the oil patch. And so I get a call from the highway department saying, "Y'all are fired." And I said, "Well," and I said, "Why?" And he told me, I said, "Oh, okay, but you can't fire me because I have a 90-day clause. You can give me notice." He said, "No, I'm the highway department. You're only mental health, so you guys are gone." Well, I took exception to that, and I called my state senators, state representatives, but I also called an investigative reporter in Houston. And he said, "Listen, I don't want to talk to you or the highway guy, but there's a human interest story here. Can you round up some people you had to lay off from Tri-County Industries?" And I said, "I think so." So the head of Tri-County Industries, Reggie, found some people. And that was back in the 80s. And they drove from Houston in the truck with a satellite dish on it. And they were interviewing these people that we had to lay off. And the first person that was being interviewed was so articulate. And to tell you the truth, I didn't think he had a mental illness. I mean, he was so together. And so Mr. Haddock asked him, he said, "Well, can you tell me a little bit about yourself?" And he said, "Yes, I've been in and out of Rush State Hospital many times over the years. I go to the hospital." He said, "I have a bipolar disorder. I go to the hospital, I get good medication, I get stabilized, so I come home and I sit in my house and I watch TV, and pretty soon I forget to take my medication, and next thing I know, I'm back in the state hospital." He said, Tri-County came and got me off a back ward at Rush State Hospital, brought me home, and gave me a job picking up trash. And he said, "I'm a crew supervisor now, and I've gotten married." And Haddock said, "Are you sure you have a mental illness?" And he said, "Yeah." He said, "When I start to get those feelings like I used to, when I knew I was getting sick," and he said this on TV, he said, "I get my butt in to see the doctor because I don't want to miss a day of work." And how powerful is that? So this person is fighting for his good mental health because he has a life, he has a responsibility, he has a wife. And we in medicine so many times forget that part of people, and especially people who are very, very ill, that have comorbid conditions and are fighting all these other things. They don't have hope. And so Janet was right. And I think that was a big success of all the different programs and silos that we tend to have success in.
And that, similar theme with the Mommies program that you created, you said that it was primarily for women who were addicted to drugs, who were prostitutes, and who grew up in the, child protective services world, and then aged out and then become really a victim of, whoever they're working for, and lose their babies. And so you created this Mommies program that treated them with dignity and respect, like any other mom who's not addicted to drugs might get. You have great prenatal care, and you have, you're treated respectfully and kindly, and it really made a difference in these women's lives. So why don't you tell us about that program and, what success you've seen from that?
Yeah. So we developed this restoration center that had a sobering unit, a detox unit, a mental health crisis unit, and we also had other services, including a methadone clinic there. And we started training law enforcement officers and for other first responders to bring them to us, rather than taking people to jail or to the emergency rooms or putting people back on the street homeless. But these women addicted to heroin, what used to happen before they come to us, and of course, once you get pregnant, you can't be on heroin. We had the only program that would treat women who were pregnant on, on methadone. And so when we started working with these women, what we found out is so many of these women had been in child protective services. So they had been abused, a lot of them sexually as young women or girls, physically and mentally, so in the child welfare system here, you end up going to a foster family, you have all these bad things, you don't get trauma-informed care, and we age you out of foster care in Texas at 18. And so, like I was telling you, Stephanie, I have two sons, one's a doctor and one's a business guy. They're great dads, great husbands. And if my wife and I had kicked them out of our family when they were 18, I don't think they would have ended up quite as well as they did. But we take these broken young people and young women, and we kick them out of the system. They get no trauma-informed care. They're broken. They don't know how to work. They have post-traumatic stress and all these poor self-esteem, as you might imagine. And so some predator, finds them. The next thing you know, they're prostituting their own drugs, and then a lot of them get pregnant. So when they get pregnant, they end up in our methadone program. And so, as you know, Doctor, these women end up delivering early. They go to the NICU. They're $1 million babies. Then Child Protective Services takes their baby away because they're prostitutes and heroin addicts, right? And it didn't take us long to figure out that these aren't prostitutes and heroin addicts. They're broken young women who have never had a chance, who were never treated with love or kindness. And so this lady named Carla Ramirez, who worked at the Restoration Center, ran it, developed this program with the University Health System, the hospital district. So we started treating these ladies with dignity and respect, got them treatment, but also got them great prenatal care at the university, and treated these young women like young women. And a miracle happened. In fact, I carry a picture on my phone. We have all these babies on a board whose mothers, they weren't taken away from their mothers, and their mothers took a different path. The babies are born much heavier, so they're not $1 million babies at the NICU, and driving up the cost of healthcare for everybody. And again, this is from the bottom up and not the top down. It's not the methadone. It's the respect, it's the treatment, it's developing a different reality. It's letting people know that they have worth and they're cared for. And I would say our staff even love these ladies. I know I did. So, combining medicine with hope and joy and recovery is essential. And I told you another story about up here. The NPR did a story, and Jenny Gold was the reporter, and her dad was a psychiatrist in San Francisco. And so she's fairly knowledgeable. And we had this program that went under bridges in Camden, trying to find people with severe mental illness and get them to come into treatment. And they'd almost always say yes. And of course the no-show rate was very high. They didn't come into treatment, even if we offered transportation. Or then we put this peer, Sam, on the team and the program is called PATH. And anyway, all of a sudden the no-show rate went way down. So Jenny asked Sam, well, how come this program really improved when you got on as part of the treatment team? And Sam looked at Jenny and said, Jenny, I've been on that same shipwreck. So that lived experience, who would have ever known if we'd had the best psychologists, the best psychiatrists, everybody else, we'd still had that high no-show rate? Because our staff were very well trained. They put themselves at risk a little bit going to these cabinets. But once you put somebody that has that lived experience as a vital member of the treatment team, all of a sudden the world changes. So again, a little bit from the bottom up and from the top down, that marriage. And we were also known, so we had lots of people visit. Two drug czars, Sebelius, when she was Secretary of State, the Assistant Attorney General of Mexico, 17 countries. I could go on and on and on. Literally hundreds of different organizations, and maybe more than that over that period of time. And they were always impressed with these wraparound services, I'll call them, that weren't funded particularly well, if at all. But what they were really impressed with was the community collaboration. How'd you get everybody to work together? So how'd you get law enforcement? How'd you get the law enforcement? How'd you get the consumers? How'd you get the hospital system? So that's the real key to this, is keeping data, because if it's not tracked, it doesn't happen, and most people don't do that. And no wonder they don't have good outcomes. You keep data, you can see if things work or not, have a continuous quality improvement. If it doesn't work, you can celebrate that because you can do something else. And people are afraid to show their warts. I mean, that things aren't working. They think it's somehow going to be a bad mark, when I thought it was a good mark, because we could change the system. So keeping data, then also having a vision. Yogi Berra said, if you don't know where you're going, you may not get there. And so many times we just throw money at problems with no vision, no tracking, those kinds of things. So I work for the state of Texas, and if you didn't have the data and you couldn't prove the cost benefit, then you're just not going any place. So I learned that right off and started developing data when I first got here to San Antonio.
It's unbelievable, Leon. I'm just blown away by all your stories. The level of impact that you've made, it's really incredible, and comes through with each ounce of what you're talking about. In addition to the ideas you mentioned about data, and in addition to the tracking, what I'm also struck by is somehow when you talk about love and hope, and being able to take care of people, you're talking about a very personal connection that really has to be established, so-called at the ground up. How do you ensure that happens for each person you're interacting with, and how do you scale that up? That's probably maybe the biggest puzzle out of all of this. You're talking about the way in which medicine should be delivered, with compassion, with hope, yet we're struggling with that because none of us have time and it's unfunded. Maybe there's some isolated examples of a nurse or a physician who figured out how to do it, yet you've been able to do it at a considerable scale. So can you shine some light on how you develop programs that really build in this quality of compassion and hope?
Two or three things. One is you have to listen, and that data is going to show you if you're in the right direction. Secondly, you have to include patients, families, consumers, and family members in this discussion, and really listen to them. And like if Janet hadn't walked in my office that day, I probably may have come to the realization, but not very quickly, without her, explaining to me that really what made a difference in her life was the organization that I was associated with. I also find a way to give her hope, and hear her and her other patients, consumers. They call themselves prosumers because they didn't like the word consumer. They wanted to be active, and they actually developed a peer group called the prosumers that's got national and international recognition, and they get together on a regular basis and help each other get jobs, start businesses, those kinds of things to the hope. So listening to people, make them part of the process. That's difficult to take that kind of criticism. And thirdly, I think that vision. Remember that story about Stand and Deliver? The school teacher that in California, who went back to high school after working in Silicon Valley and wanted to teach computer science. And the high school he went to didn't have any computers, right? So he couldn't teach computer science. So he ended up teaching algebra or whatever. And the other teachers in the teachers' lounge, give this picture of the people that lived in that area and went to school as being non-caring, drug addicts, gangbangers. Be careful, they're going to slash your tires and key your car. And he refused to believe those students were bad, stupid, whatever. Treat them like they were smart, treat them with dignity. And by the time they got out of high school, they were the best in the state of California, to the point where they thought they were cheating, because how could the best and brightest come out of this barrio school that was drug infested? Well, it's that one guy who believed in these kids. And that whole thing about the Pygmalion effect, the self-fulfilling prophecy, you've got to convey that to your staff. That even if you're an aide or a janitor, you've got to treat people like they have worth and like they can do great things. And if you treat them like patients, even in the health professional, we still call people chronic in my field. I mean, what kind of message does that send to everybody? So developing that Pygmalion effect, the self-fulfilling prophecy, that in every one of your staff, that they have a lot of power to change people's lives just by how they treat them and what they expect from them. And so the active ingredient isn't the medicine, it isn't the treatment, it's that belief in people and developing that culture of health and healing and hope.
You've told me before that it's a little bit challenging to get people on board to really realize that these things that might be seen as fuzzy can actually make tangible, both impacts in monetary improvements, in improvements in their, the incarceration rates and everything else, medical improvements. And so what would you tell these people who might, want to make changes, the providers and the, other law enforcement and mental health providers and everybody who might want to have these same types of results that you do, but have a hard time believing that the fuzzy things like hope are what really makes the difference in treating these people so that they do have that positive self-fulfilling prophecy? How do you get them to believe that this does work?
Yeah, well, you start where they are. And I have this thing that I tell people when they used to come and visit before I retire. They would look to see these programs and how wonderful they were, and all the different money that we were able to bring in and try to blend, braid, and integrate federal, state, and local dollars and drive out the waste and duplication, and keep this data to show that there's cost benefit and a lot of savings, not only saving lives, but also actual dollars. And I would tell people we were a 18-year overnight success. So you don't start at the end, you start at the beginning. And when we first started, we had nothing. I met with the county judge. They were talking about adding 1,000 beds on the county jail, which we never did because the Texas Jail Standards Commission was threatening to shut them down because of overcrowding and deplorable conditions. And so you start where you can. Overpromise and underdeliver, because if you make all these grand promises and you don't deliver, then you're going to lose everybody's enthusiasm or respect or whatever. So, start slow, keep data, have continuous quality improvement, and then realize that unnatural partners sometimes are your best partners. So since we didn't have any money, one of the first things we were able to do is start training law enforcement officers in crisis intervention training. And most law enforcement at the time would go to the academy, and at the academy it's like going to boot camp. You learn how to use all your hard skills, your command voice, your command presence, how to use your weapon, how to use a taser, how to use an ASP, but you're not taught any soft skills. And 85% of your contact with the public, you shouldn't be using those command voice and command presence and those hard skills, because it's just going to escalate, the problem, because your calls are going to be mental health calls, family disturbance calls, adolescence out of control. And you need to have these other set of tools that are softer. So we taught these law enforcement officers, and in that first class, I heard things like, I'm a cop, I'm a cop, I'm not a social worker, I don't believe in these hug a thug programs. And by the end of the 40-hour training, which over 20% of that, 20 hours of that training was role playing, where they're taught to recognize the signs and symptoms of mental illness and step back and use these de-escalation techniques. By the end of the 40-hour course, all these really hard law enforcement officers who didn't believe in these programs were going, oh my God, I can't believe I didn't have these services for. And I told you, and at the end of this, we're having HBO do specials about our law enforcement officers here, Nightline doing a special. The officers taking a lot of pride in the fact that they can take somebody to treatment and not taking them to jail, that they've seen over and over and over again. And they become a real law enforcement officer in the fact they can do good community policing and use the right tool at the right time. So, how you engage people that are non-natural partners, that you don't have the same language, have the same philosophy, it's possible, but you got to start slow. And you got to, have some buy-in from the leadership that they'll at least try.
Thank you so much, Leon. This was so enlightening. It's just so much ground to cover, because you've done such amazing work in virtually every realm of mental health, and it's so impressive. So we really appreciate you being here and chatting with us.
Well, it's been a great honor and very humbling for me to have the opportunity to have the wonderful life I have. Thank you.
Incredibly inspiring. Thank you for sharing that with us, Leon.
Oh, you're welcome. My pleasure.
And thank you all for watching. Bye-bye.
Bye-bye.